Hello, everybody. Greetings from MedTalks and Heartcare Foundation of India. I am Dr. K. Aggarwal. I have with me Dr. Purnima Makhija. She is a pathologist, a molecular pathologist in London, and we are going to interact with her on the recent pathology being evaluated all over the world in COVID-19. What is your pathological experience in COVID-19? What do you think? What the cause is?
So, cause of course is probably, as you all know, it's a novel virus. So it's probably animal derived. As far as the pathology goes, we are in the process of doing large studies with autopsy material from various centers. So a lot of my colleagues are doing COVID positive autopsies, and lots of stuff has been published on that ARDS and peculiarities with COVID in COVID positive deaths. So that's ongoing.
So, if I have to talk about pathology, some people are
Yeah.
talking about it is a new angiogenesis. Some people are talking about interception of the vessels. What are the possibilities where we can explain all the symptoms of COVID-19?
Um, I to hand, I don't have all the material with me at the moment because I haven't personally done any COVID autopsies, but I know that my colleagues are doing it, and there's a lot of literature out there which has been published. While this process, this conversation is going on, I can get some more inputs from them and find out and let you know feedback to this group about
So,
all the
what is the
findings.
status of corona in UK as a whole?
Yeah, so in UK as a whole, the numbers are dropping. We are now 2 weeks into a partial release of lockdown, and our new cases is coming up to about 1,000 per day, with the deaths going down from something like 980 at the peak to around an average of 200 um, deaths per day. So there's definitely no doubt that the peak has seems to have passed. I must say that the lockdown reopening has not been complete. For instance, we don't have our restaurants and pubs are still not open, and even at the very height of lockdown, we were allowed to go out into parks and do physical activity, and that has increased now. And people are allowed to visit people who were being shielded because of health conditions, and NHS was providing those people with drugs and food at their doorstep. Those people are now allowed to go out into the public. People are allowed to meet small groups. So single people who are living in isolation are allowed to visit a family. So the lockdown has opened very step by step, very gradually, and the numbers are not rising tremendously as yet. Schools are reopening to a very small extent. So year one and year six students are allowed to go to school now, but that is optional to the parents. If they feel that their child has any health conditions, or if they don't feel confident about sending their children back to school, they have the option of not going back to school. So that is certainly something that is being considered. As far as So these are the kind of opening up of the lockdown that has occurred. Whenever it gets sunny, there seems to be quite a bit of thronging of people in parks and beaches. And although people are being urged to maintain social distancing, that is often not the case in such gatherings. So also we've had the recent protests about all Black Lives Matter, and a lot of people have taken to the streets to protest about the inequalities to the blacks and the recent problems that occur in the US. That again has been done with masks, but there's not much in the way of social distancing there. So uh, be it with all these little spurts of crowding, the lockdown has eased out quite considerably, um, and and there has been no commensurate big rise in numbers yet. Really, time will tell, and also the fact that when we do reopen things like pubs and restaurants, and we open schools to a full extent, what the level of rise of cases will be, only time will tell.
So if I go back to the numbers,
Hmm.
India today has crossed UK.
Hmm.
India has now 297,001. That means we are ahead of number of cases. India is number 4 now, and it will stay at number 4 almost for the next maybe 1 month, and then we will see whether USA, Brazil, Russia, and India are the number 4 countries now. But if I see the mortality, the death rate in India is 6 per million population, and that of UK is 608 per million population. So if I see the top 5 countries, the maximum death rate is UK, then comes is Spain, USA it is only 348, and India it is only 6 per million. So if you
Yeah.
see, if we divide the whole world into 3 groups, we have Asia, we have Europe, and we have the North America. Europe has the maximum mortality. Then number 2 is Northern American countries, then Asia. And in Asia, the least mortality is Asia, Singapore, and Taiwan, South Korea. And the highest mortality is in the Iran group, Saudi Arabian groups, and we are in between. And all the countries are behaving the same. Do you feel that in Europe there is a different pathology of the virus, more of a hyperimmune inflammation, and in India we have more of hypoxia?
I don't think. I mean, I wouldn't. Again, I would not be able to answer that until I see, comparisons in terms of autopsy findings, etc., or and even clinical findings for that matter. But there are 2, 3 reasons why UK is so high up there in mortality. One is when the initial death rates were being examined. At that stage, there was nobody gave any importance to the deaths that were going on within the care homes. So the care homes was an sort of tested and an unknown almost entity. And suddenly, when they realized that it's spreading like wildfire in care homes, which are basically what we call vridhashrams in India, they are all the elderly people who are being looked after in these care homes. And there was no initially there was no screening of people who were coming to visit the care home inmates, and there was no sort of testing going on. Everybody was freely allowed to meet their parents and elderly people in the care homes, and there was this huge spike in deaths, which spread like wildfire within the care home population. So I think one of the reasons why the deaths have been higher in UK certainly is, one, there's a higher aging population. So the percentage of population above the age of 60 is extremely high in UK, and in fact, indeed, as also in other European countries. And second is that the 2 areas where we could have checked our death rate was, one is we had been very vigilant about being strict with admissions into care homes and providing better PPEs for care home staff, etc. That could have been curtailed. Maybe slight earlier lockdown, slight earlier closing of borders may have helped to initially. Now they're saying that our death rate would have been halved if we were careful of those things. So I think that has been the huge factor in the high mortality in UK. Aging population and no importance given to care home numbers. And in fact, they were not even recorded in the initial death rates when they were being hospital death rates were being recorded. Then they were suddenly realized, oh gosh, we missed this entire cohort of people who are rapidly dying, and then these were added on to the death rates. That's why our numbers are really bad.
So thank you, Dr. Purnima, for being here. But before I say goodbye to everybody, all my listeners, because we are live on YouTube, we have few questions which I like to cover it up. Is सर चेस्ट में दर्द था 2 दिन का अब ठीक हूँ forget about it, it's not COVID unless you have fever. Want to know proper guidelines for clinical OPD. Dr. Pandey, maintain social distancing and maintain double masking because you are dealing with public, so you will be high risk. stop testing asymptomatic patient to reduce case. It's now in the clinician to decide whether to test or not. Such then we have tell lung exercises to expand the lung capacity, abdominal thoracic breathing, and start lying on the abdomen. Doctor, what is the impact of COVID-19 for those person who have sinuses? Yes, sinuses को कंट्रोल रखो, क्योंकि अगर वायरस हुआ तो पता नहीं लगेगा कि साइनसाइटिस है, एलर्जिक है कि वायरस है. तो अपने साइनस को कंट्रोल में रखो. We says we watch your video from Toronto. Thank you. I'm 40-year male with diabetes diagnosed last year. Last एक साल से मैंने कोई दवाई नहीं ली है. मेरा डायबिटीज का HbA1c 1.5 है. नहीं, आप हाई रिस्क में नहीं आओगे, आप नॉर्मल रिस्क में आओगे क्योंकि आपकी डायबिटीज कंट्रोल्ड है. Thank you everybody who was watching even at this time to our program. Thank you Dr. Purnima to be here with us. We'll interact with you again in couple of days once you have more data with the, maybe we try to bring in one pathologist with you who can interact with us on the autopsy reports, because in India every doctor would like to interact with people who are doing autopsies all over the world. Thank you for being with us.
Thank you. Bye bye.